Welcome to Monday's edition of COVID-19. I'm Min Sun-hee. We are starting the first work week of this month here in Korea with infections below 100 and revamped social distancing guidelines that seek to balance public safety and economic stability in the face of a prolonged pandemic. We have details later on in the program on that. Here first now is our Kwon So-ah with the latest numbers on the pandemic. So let's begin with the situation on the local front for this Monday.
Sure, Sunny. The first Monday of the month kicked off with almost 100 COVID-19 infections. It is a drop from the weekend when the country reported 127 and 124 cases. But we also have to consider that always on the weekends, there is a lower number of tests conducted. So let's take a look at the details now. With 97 new infections, the country now has 26,732. 2 fatalities were reported, raising the death toll to 468. A little less than 1,900 people remain in quarantine, and almost 24,400 people have made a full recovery from COVID-19.
Right. So I also hear authorities were on high alert this past weekend, given the celebrations over Halloween, right?
Yes, Sunny. Officials were busy over the Halloween weekend as they conducted special inspections at high-risk entertainment venues, which they are actually continuing until Tuesday. Now, those were concentrated in the capitals Itaewon, Gangnam, and Hongdae areas, which are the hotspots for Halloween festivities. In Itaewon, 2 checkpoints, or so-called quarantine gates, were installed, where visitors had to submit QR codes, have their temperatures checked, and even got disinfected from head to toe. Now, back in May, a massive outbreak of the virus was traced to a nightclub in Itaewon. Popular clubs decided to close during Halloween until tomorrow, but despite all these measures, people did flock to the area with social distancing in many cases impossible outdoors, indoors as well as outdoors on the streets. Now, speaking of social distancing measures, the government, as predicted, announced a reform to the 3-tier social distancing scheme on the weekend, which will now be a 5-tier system beginning on Saturday this weekend. So levels 1 and 2 have been subdivided to respond a little more flexible towards the coronavirus situation here in the country. Now, as of Monday, the metropolitan region reported a little over 60 cases. So according to the revised social distancing measures, this number has to stay below 100 for a week so that we can remain at the lowest social distancing measures at level 1. Meanwhile, 11 major regions in the country have been affected this Monday, with 79 domestic cases and 18 from abroad. And speaking from abroad, let's take a look at the situation elsewhere. We have the U.S. with over 71,000 new infections, now approaching 9.5 million cases. And then we have Russia also seeing resurgences with 18,000, and really a serious situation in France with 46,000 new infections recorded in just 24 hours as of noon Korea time. And also the UK here has hit the 1 million mark over the weekend. And if we move over to other places, we have Italy, which has surpassed the 700,000 mark. And here, Belgium has appeared on our table here with the 18th highest number of infections around the world. And this country also had some 17,000 new infections in just a day. And now the total figure stands at 46.8 million across the world, with 1.2 million fatalities and 33.7 million recoveries. And those are the figures I have for now, but I'll be back in a bit after the government briefing. Back to you, Sunny.
All right, so thank you for that. Right, back here on the local front, cash services for the elderly have been disrupted by the pandemic, and authorities are now turning to technology to provide these vulnerable citizens a helping hand and more. To take a look.
This elderly woman, surnamed Kim, has a new grandson.
할머니, 우와, 머리도 쓰다듬 해주세요.
알았어.
할머니, 쓰다듬어 드리고 싶어요.
내 머리? 아유, 걱정 마라.
His name is Hyodol, an AI-equipped robot companion. Resembling a rag doll, Hyodol utilizes the latest in IoT technology. Hyodol immediately responds whenever you pat him on the head or hold his hand. You can have a conversation with him or even have him sing for you.
저를 항상 이뻐해 주시고 손도 잡아주셔서 감사합니다. 정말
알았어.
많이 사랑해요.
알았어. 나도 감사하지. 같이 있어줘서.
Hyodol also reminds you when it's time to eat, exercise, or take your medication. It is equipped with sensors to detect the motion of elderly users and sends out an emergency text alert in case of a prolonged period of no movement. Hyodol was introduced in mid-October by a clinic for the elderly in the city of Goyang, north of Seoul.
코로나19로 인해서 그 어르신들이 신체적, 정신적 고통에서 많이 힘들어하십니다. 그래서 이 인형은 그냥 집에 혼자 계셔도 인형과 많이 소통을 하면서 인지 기능을 강화할 수 있고 그로 인해서 정서적 안정감을 도모할 수 있기 때문에 저희가 이 사업을 시범 사업으로 진행하게 되었습니다. 우울감이 많이 향상된 분들하고 그다음에 이제 홀로 사시는 치매 어르신 그리고 또 이제 사각지대에 계신 분들을 저희가 선발해서 이분 10분에게 우선 선정해서 지원하게 되었습니다.
The clinic also provides a variety of other welfare services for the elderly.
치매센터에 와서 하던 모든 프로그램을 집으로 옮겨드리는 그런 비대면 사업의 일환으로 문고리 학습지 배달이라든지 또는 효도리처럼 집에서 안정감을 좀 더 향상시킬 수 있는 효도리 인형을 더 지원할 예정입니다.
It is hoped that these technological innovations and more will help provide at least a small measure of comfort for elderly citizens who are suffering greater isolation and loneliness than ever before amid the pandemic.
Right, so you're here back at the desk joining me. We are still waiting for the briefing, of course, to start, and then we'll probably talk again. Well, like I said, it is a little after 2 in the afternoon here in Korea, and we are poised to join the regular government briefing on COVID-19. Now, as our consul mentioned earlier, authorities have disclosed a fresh set of restrictions that includes 5 levels as opposed to the former 3. And these revised guidelines seek a sustainable approach to stemming the spread of COVID-19. Now, up on the screen, we first share with you a brief definition of each level. Level 1 refers to sporadic infections that are within medical capacity. Level 1.5 refers to community infections that burden medical capacity within a specific region for a week or more. Level 2 refers to serious outbreaks within a community that look to spread nationwide, while Level 2.5 refers to a nationwide outbreak that threatens healthcare systems across the nation for a week or more. Level 3 refers to a serious nationwide outbreak that is poised to crash the nation's healthcare infrastructure. With regard to the actual numbers of daily cases, the ceiling that determines the level of social distancing seems to have been raised, but officials have claimed the new guidelines aim to ensure an effective and an endurable, if I may, fight against the prolonged pandemic. Level 1 will be issued when cases hover below 100 in the metropolitan region, below 30 in other regions, and below 10 in Gangwon province and Jeju Island. Now, previously, the ceiling was sternly set at below 50 nationwide to allow for Level 1 guidelines. Meanwhile, Level 1.5 will mean the number of daily transmissions has surpassed the ceiling set under Level 1. Level 2 will be put in place if daily infections hit 300 and above nationwide for a week. The other 2 conditions for Level 2 include a week-long daily infection rate of more than 100 in the metropolitan area, more than 30 in other regions, and more than 10 in Gangwon province and Jeju Island, as well as over 2 provinces witnessing their Level 1.5 daily infection numbers, that is, for more than a week. Level 2.5 will be imposed if daily cases hit between 400 and 500 above for a week. Level 3 will be called if daily cases hit between 800 and 1,000 above for a week. As for the safety measures under each level, Level 1 allows for a normal sense of life with all safety measures in place. Level 1.5 calls for a stringent practice of preventative measures, especially at priority facilities. Level 2 urges for limited social gatherings and visits to public venues. I believe the briefing is about to start. We'll come back to you afterwards with a summary of it.
Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of November 2nd, Monday, we have 79 new local infections and 18 new imported cases. The total caseload now stands at 26,732. Currently, we have 1,869 people in quarantine, and there are 49 patients with severe or critical conditions. We had 2 additional fatalities, and the accumulated death toll now stands at 468. The fatality rate stands at 1.75%. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the major updates of our domestic transmissions. In relation to a music school here in Seoul City, we also found 2 additional cases. A total of 18 have been confirmed to date. Among them, 10 are students and 3 are teachers, and also 5 are families and acquaintances. And in relation to the ACE Hope Care Center in Dongdaemun-gu District, we had 3 additional cases being confirmed. A total of 13 have been confirmed to date. Among them, 8 were the users of the facility. And in Gangwon-do Province, Wonju City, in relation to a family there, we also have confirmed that 2 more cases have been confirmed after the 30th of October, and a total of 33 have been confirmed to date. In relation to the SRC Rehab Hospital in Gyeonggi-do Province, Gwangju City, we have 4 additional cases. A total of 154 cases have been confirmed. 47 were patients. And also in Gwangju City, we have a family gathering. The first case has been confirmed on the 31st of October, and currently we have 22 confirmed cases to date. And in relation to Paju City and the logistics center there, we also have the first index case being confirmed earlier, and a total of 13 have been confirmed to date. And in Chungnam area, in relation to an office space in Asan City, we also have the first index case on the 30th of October, and we have a total of 19 have been confirmed to date, and 6 of them were the colleagues, and 3 were related to a bar, and also 5 were related to a sauna, and we see major transmissions through multi-use facilities. During the past week, we have assessed the weekly risk assessment indicators, and they are as follows. The daily average new confirmed cases on a daily basis, we have had 86.9 cases, which is up by 11.6 from the previous week, and we are seeing an upward trend for the 3 consecutive weeks. And also we have about 18 cases on a daily basis of imported cases, which is a slight decrease from the previous year. However, we are also seeing that these cases hover around 20 on a daily basis due to a global outbreak as well. And as for the sources of infection, we have seen that 238, about 38% were related to cluster infections, and 17.4% were related to the imported cases, and also 16%, or about 118, were in relation to long-term care centers, and also we have about 13% which are under investigation. We had 9 fatalities last week, and 4 of them were in the age group of 80 and 5 in their 70s, and also 8 of them had underlying illnesses, and as for 1 person, we are conducting further investigation. As we witness a global outbreak, which is even severe than the spring outbreak, especially in the US as well as the Middle East and Europe, we also see of more than 46.8 million cases globally, and also fatality standing at 1.2 million. And in order to intensify our quarantine measures for the long-term care centers for the elderly, we will be expanding the mass testings for all of these nursing hospitals nationwide, and we will also carry out these testings on a regular basis. Currently, we are conducting the mass testings for the Seoul metropolitan area, and about 3,300 facilities have been completed testings, which means that that about 900,000 people have been tested so far. And also we are conducting these investigations, and as for these the results, we have seen about 20 people being confirmed at a total of 5 facilities in Seoul and Busan as well as Gwangju. And also as for the facilities, we have 1 nursing hospital and nursing care center in Seoul, and the index case was also a user in one of these facilities, and in other facilities they were the caregivers as well. And in Dongdaemun-gu district, in relation to a long-term care center, we also have seen additional cases being confirmed, and the same has been also applied to Busan as well. And we will also expand these testings nationwide during some time in November, and we will also be regularizing these testings going forward. And we are also conducting our investigations on mental hospitals and long-term care centers as well as care facilities, and we will also make sure that we can contain the virus, especially at the high-risk facilities, and we will intensify our quarantine measures for the senior citizens. And starting from October 12th, we have seen the easing of the social distancing measure to the lowest level, and since then we have seen more increase of foot traffic, and people were having more events and gatherings, and also due to the chilly weather, people are congregating indoors, and therefore people will also have more likely to be exposed to confined, crowded, and close contact environment. And we are also seeing a risk of a possible outbreak of the influenza as well, and we believe that there are many risk factors that could spark a massive outbreak of COVID-19. Therefore, we also continue to advise the public to comply with the quarantine measures, including wearing face masks, keeping a distance, as well as washing of their hands. And if they have any symptoms, we ask you to get tested as soon as possible. And especially if you have been to Halloween gatherings or social gatherings or religious gatherings where people did not wear face masks and shared meals together, and if you show symptoms after visiting these gatherings, we ask you to get tested as soon as possible. And we also have the upcoming trend for the influenza outbreak, and currently we are containing the outbreak of the influenza to a minimum level right now. However, we have seen that the virus has been detected among the respiratory samples, and about this stands at 0.3%, and we see that the virus is being detected among samples. And in order to contain the influenza outbreak, we ask you to get vaccinated, and also it applies to the same quarantine measures as COVID-19. Please wear your face mask and wash your hands and keep healthy distancing as well. And globally, we are seeing a resurgence of the COVID-19 virus, and we believe that until we have an effective vaccine and therapeutic being developed, we believe that this situation of a pandemic will be prolonged until we have such developments of the vaccines and therapeutics. Of course, we are looking forward to the development of vaccines. However, we still have much time left until we guarantee the safety and effectiveness of the vaccines. And there are also many uncertainties until this point. And currently, the aim of the quarantine authorities here in South Korea is to contain the virus so that we can maintain the medical capacity. And it is very important for us to strike a balance between quarantine measures as well as our daily routines, especially economic daily routines. However, it is a very difficult situation right now. And this calls for our personal quarantine, which is highlighted by testing and also wearing face mask. And in order to prevent yourself from getting infected, also preventing others from getting infected, you need to wear face masks. And face masks need to be worn properly. And looking at major cluster infections, we have seen that many people did not wear face masks. And also, if you have worn the face mask throughout the day, day. And if you decide to take this off when you are enjoying meals and to engage in dialogue and also working out at indoors or singing, you could also be you also could be prone to higher risks of infection. And major examples of the cluster infections were related to the eateries as well as bars, as well as swimming pools and indoor gyms, and also music schools. And also there were also many cluster infections which is spreading through small groups and small meetings with acquaintances and family members. So it is crucial for you to decrease and minimize the time when you do not wear your face mask. And second, it is very important to have social quarantine, which is highlighted by social distancing measures. And in order to contain the virus from spreading through multi-use facilities which are frequented by people, we need to also comply with the quarantine measures at these facilities. And they include all of the users and managers to wear face masks, and also ventilating the space on a regular basis and disinfecting multi-touched areas as well. And starting from next week, we will also have the revamp of the social distancing scheme. And starting from 13th of November, we will also have penalties on people who do not wear face masks. And in the end, it is all important that we have a social responsibility going forward. And third is to increase the medical capacity and our response scheme as well. And the quarantine authorities will expand the number of testings going forward, and we will also intensify the epidemiological investigations as well. And we will also guarantee that we have an increase of more hospital beds, especially for those who are in critical conditions. And as the COVID-19 pandemic is also lingering on for the past 10 months or so, we believe that if we stay complacent, this moment of complacency can lead to a wider outbreak. And we need to always stay on vigilant as well. And we need to remember that we cannot take off our face mask, and we need to always wear face masks and wash our hands and get tested as soon as possible if you have symptoms. The quarantine authorities will also exert our full efforts.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 서울 기자실에서 질문 먼저 주셨습니다. 국민일보 기자님.
Right, that was Cheong Young, Commissioner of the Korea Disease Control and Prevention Agency, with Monday's briefing. So, what was the gist of her address today?
Well, as it is Monday, let's start with the risk assessment by the government from the past week. An average of 86.9 cases were reported on a daily basis in the past week, and that is up by 11.6, which means for the third straight week, we are seeing a rise in domestic cases. And imported cases were at 18, which is slightly down, but Tong mentioned that there is still a risk factor because the resurgences abroad are continuing. And around 40% of cases were cluster infections. And speaking of which, we had new cases related to an academy in the capital Seoul, and also more cases linked to a rehabilitation hospital in Gyeonggi-do province, as well as a family gathering in Gyeonggi-do province. So we have been talking about these clusters weeks ago, which shows that these cases are still leading to secondary and tertiary infections. Chong also asked for extra caution after the Halloween weekend and asked for people who were at any gatherings, religious gatherings or Halloween celebrations to get tested for COVID-19 if they feel any symptoms related to the virus. And last but not least, the 5-tier social distancing scheme is going to start at the end of this week, and that also includes new measures regarding wearing a face mask. So beginning on the 13th of November, people can be fined for not wearing face masks in public locations.
Right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Also around the world, protesters in Brazil took to the streets this weekend in support of President Jair Bolsonaro's stance against COVID-19 vaccination. For more on this, I have Luana Ferreira, a journalist there, live on the line. Good to see you again, Luana.
Good to see you again. Thank you for welcoming me again, Sunny.
Right, Luana, Brazil has been tapped to test a number of leading vaccine candidates, but such plans have been thrown into chaos amid a political war waged by President Bolsonaro against supporters of vaccinations, namely the governor of São Paulo, João Doria. Could you please tell us more about this?
Yes, of course. Well, Bolsonaro knows how to make the headlines, doesn't he? A few days ago, he said that he's not going to buy the vaccine from China at any circumstance because Brazilians, they are not guinea pigs, and we should not trust a vaccine that comes from the country that created the virus. So going against not only João Dória, who negotiated the vaccine from China, they bought nearly 50 million doses of the vaccine, but he's also going against people who are close to him, his supporters, like his health minister who signed the deal, who allowed the deal, and also the vice president who already contradicted Bolsonaro and said that we are going to buy the vaccination. So we are going in the middle of battle to see what's going on. But we also know that Bolsonaro quickly changes his mind when it comes to when he's pressured.
I see. Luana, I suppose we need to see this latest situation within the context of the upcoming municipal election this month, which is seen as a dress rehearsal for the presidential race in 2022. And speaking of the upcoming local election, I hear that a number of candidates have tested positive for COVID-19.
Yes, they did. Every day we hear that a new candidate was infected by COVID. We don't have the total number, but we know that until the moment, from September until now, 20 candidates died due to COVID. The numbers are sad and scary, but it's not surprising when you look at the dynamic of those events. When you compare the campaigns this year, it's not very different from what we have seen in the other years, with hundreds of people together. The campaigns, they resemble street parties. So people are not wearing masks and not taking the proper measures. So those places, they become high-risk events for COVID.
I see. Luana, have these unfortunate events led to any changes in the election schedule?
There were, but not very much. The first change was the date of the elections. They were supposed to happen in October, but they postponed it to November because they had hopes the numbers would slow down. But now there are little measures, like, for example, exceptionally this year, we are not going to have the biometrical identification. We have to bring in an ID when we're going to vote. And people who are older, 60 or older, they have priority to vote when they show up between 7 and 10 a.m.
I see. Luana, staying with the rampant infections of people there, according to data by Brazil's health ministry, a health professional is infected by COVID-19 every minute in the country. Do tell us a bit more about this shocking reality.
Yes, and right now we have nearly 500 doctors who died due to COVID and over 400 nurses. And the numbers are scary. And in the beginning of the pandemic, the associations who protect the health workers, they highlighted the high mortality in Brazil because those professionals who are in the risk groups, like people who have diabetes, people who are older, they were not sent away from work. They kept working. So that was one of the reasons, but we don't know how is the situation right now. We have the numbers, but we don't have the scenario and how if things have changed. So we cannot make a statement why people are still dying in the hospitals when they're doctors.
I see. I believe, Luana, researchers there also reported a rare case of relapse of COVID-19 symptoms in a 24-year-old nursing technician in an interval of 50 days or so. Could you tell us more?
Yes, it's actually a 40-year-old nurse who lives in Aracaju in the northeast of Brazil. And they did not confirm it yet, but she was tested positive twice in June and July in a space of 54 days. And it's not the first time we see a reinfection case in the role. But what surprised people is that normally there is a window of at least 90 days between the first infection and the second infection. Although the doctors, they did not confirm it yet, they said that when they compare the samples, they can already see a mutation between the first infection and the second one.
I see. Luana, one final question before you go. Adding on to Brazil's woes, since the beginning of this year, Brazilian scientists have reported more than 3,600 fires in the Pantanal, the world's largest tropical wetlands. Tell us a bit about the situation there.
Well, it's very sad, and it's a second tragedy besides COVID in Brazil. Since we start monitoring the areas, the fires in the area in the 90s, we have never seen something like that. And it's when you think that about the area that's burning, it has been an area that's bigger than the country of Israel. That's huge. And not just about numbers, because 20% of the biodiversity in the area has been burned. And there are plants and animals that just exist in that area. So it's very worrying, not just for Brazil, but for the whole world. And also there are indigenous areas that are protected there that are being burned. So it's a huge loss, and we cannot put a price on that or measure just with numbers.
Right, it is a sad and shocking loss, of course. All right, Luana, as always, thank you for making the time to join us live at this hour with the latest
so much for welcoming
from
me
Brazil.
again.
Right, Luana, bye-bye for now.
Bye-bye.
이번 개편의 목표는 지속 가능한 방역 체계의 안착이며 키워드는 정밀 방역이라고 할 수 있겠습니다. 사회적 수용성이 떨어지는 단점을 보완하기 위함입니다.
Social distancing guidelines here in the country have been revamped to take into account prospects of a prolonged pandemic, economic stability and public safety. For more on the new detailed framework of preventative measures and vaccine efforts, I have Dr. David Kwak from Suncheon University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
And I also have Dr. Kim Seung-taek from Institute Pasteur Korea. Good to see you again, Dr. Kim. Dr. Kwak, the key words for the revamped social distancing guidelines appears to be sustainable and a targeted approach to a prolonged pandemic. What are your thoughts on these new revisions?
Right, so they made a more elaborate scheme about how they're going to handle the currently ongoing pandemic. It seems like they've switched over from originally wanting to make the number go to 0, but instead now, because it seems like it's going to go much longer than originally thought, they're trying to managing the system, get the economy going while still mitigating the virus and also minimizing fatalities from it. More in detail, the 0.5s, the 1.5 in between 1 and 2 and 2.5 in between 2 and 3 is more of a preparatory step to my understanding. It's more, so if we specify these numbers, they're going to look at different numbers from different localities, meaning different regions have different criteria of putting the level up or down. At the state we are having numbers below 100, especially for the metropolitan area near Seoul area. If we continue to have numbers around below 100, we're going to keep staying in the level 1. If we start to see anything above 100 in the metropolitan area, we're going to go to 1.5. But what's different from then on is that from level 2 and up, it's not so much about exact numbers. It's more about the speed of the increment of the increase. So if we start to see, let's say, the number suddenly doubles, or if we start to see the virus dispersing to other local areas, then they're going to upgrade to level 2 and above. So I think it's a good approach by the government to take on at this state, because we are now seeing that we're able to handle the number of severe patients that are coming out of daily hundreds of confirmed cases. As long as we could contain it within hundreds of number, it's not going to become suddenly so serious like the situation we used to see a few months back. So government, I think, has taken a timely appropriate and situationally appropriate measure at this time.
Do you see these latest revisions as perhaps fueling a sense of complacency among members of the public? Because the ceiling that had been set for certain levels to be imposed has been raised, so to speak. Because previously we had 50 infections or so for us to ensure level 1 situation, but now it seems to be about 100.
Well, I don't think, personally, I don't think the measurement or the criteria that they put up is going to have people suddenly become more lenient about the whole measurement. We now are at a situation where we've experienced enough to know that this is a serious of a matter. It's not something to take too lightly on. Whether we change the number from 50 to 100, it's not going to change people's mind that, oh, we're going to not wear a mask because we're still below 100. That is going to be still pushed on the people by the government, and it's more importantly the consensus among people. Based on what we already know, what we already experienced, we are still going to be alert about the whole situation. So I don't think really either changing the numbers or even having it make more elaborate, such as putting 0.5s in between, is really not going to affect people in a way that they have a different feel about this, different scare about this. So I don't think that won't be too much of a matter.
Right. Dr. Kim, what are your prospects with regard to the global situation of COVID-19 in the absence of a vaccine?
In the absence of vaccine, well, it's hard to tell, but actually we need a vaccine eventually. Otherwise, this situation, I don't know how long it'll just last. Maybe just maybe dozens of years or so. Then the vaccine development is very important. But it is very important also to note that recently, Dr. Anthony Fauci from the U.S. National Institute of Allergy and Infectious Diseases, he said, well, the United States won't get back to normal until late 2021, even after the successful vaccine development, which actually includes the the production and then distribution, the issues as well. So, and then the current vaccine is, well, based on the current the design of the vaccine, it does not actually prevent the infection itself. It can infect probably disease, but it does not impact prevent the infection. So even after just the vaccination, people get infected, but that does not progress to the severe disease. But those the vaccinated people can infect it, and then also just to infect transmit the virus and infect other people as well. So then maybe just achieving the herd immunity is very important. So in this point, I think all the changes about just the Korean government is actually just considering just the balances between the quarantine and the economy. And anyway, just by the end of the 2020, at least for United States and probably in Korea, maybe end of the 2021 or 2022, early 2022, while the wearing mask and the washing hands and just keep social distancing is the best the strategy we have to keep.
Right. Dr. Kwak, despite warnings by health authorities here, quite a number of people gathered in Seoul's Itaewon area, Hongdae and Gangnam to celebrate Halloween. Do you see these celebrations as perhaps sparking yet another large-scale outbreak here in the country?
I do see a great possibility there. We've already seen this happen before with the Itaewon cluster infection a few months back. One thing I really want to emphasize here is that we've already started seeing the base number go up in the domestic cases. We used to have 30s and 40s and well below 30s and 40s, actually even before that, of domestic cases happening from all over the nation. Now we're seeing, looking at least 70s or up to something somewhere in the 90s of a domestic case daily. And on top of that, since we've just been through Halloween weekend, but we've also seen a lot of other people, because the weather was so nice, were just enjoying their time at their other local places. So there is a great chance, I think, that the number could actually go up sometime within the next 2 weeks or so. But I'm still having my fingers crossed and hoping that it won't exceed a certain number of capacity that we have to take care of the people, and hopefully it'll go back down very soon.
Dr. Kwok, as Chong Gyong mentioned during the briefing today, we have an average this past week, 86.9, I believe, cases. What are your thoughts on the current situation here in Korea?
Well, it is being stabilized. Even though the number has went up, it is still being stable in the sense that it hasn't exceeded a total number of 130. The domestic cases, the number stayed within the 90s of the numbers, and today, luckily, we saw something in the 70s. If I may foresee just a little bit, I do anticipate it to go up a little higher, though, because the compositions of those daily cases are now becoming more small in their cluster sizes, meaning it's becoming more localized, it's becoming more dispersed into the very core of our society, not as it used to be where we just saw massive numbers coming out of this huge places. So that's one thing I'm particularly worried about, and I do see because of that reason it may go up just a little higher, but hopefully the government will take good enough actions to mitigate and minimize the numbers even from going up.
Right. Dr. Kim, I'd like to direct your attention now to a potential treatment for COVID-19. Remdesivir is the only antiviral drug that's been approved by the US for treatment of COVID-19. Here in Korea, we also use it, if I am right, on severely ill patients. We've administered it to at least 700 severely ill patients. But a study by the WHO shows that it has very limited impact on COVID-19 patients. What are your thoughts on the drug Remdesivir?
Well, for all kinds of just a medication so far, there are actually some conflicting or sometimes the mixed evidence is just floating around. Even for Remdesivir, I mean, not only just this WHO report, but before just a US NIAID study, there was some conflicting data from, as far as I remember, is from the China. And then also now just the US, and then in the case of US, they actually conducted very organized, very randomized this controlled study. And then based on that study, actually, the Remdesivir was firstly just authorized for emergency use. So I think the data is quite convincing, and then I think it's pretty good. But then the WHO report is also just indicating some other aspects of the efficacy of a Remdesivir, but this is not actually has not gone through all the peer review process at this moment. So we will see what will eventually be printed out after peer review process. And then in addition to Remdesivir, WHO also reported some other medications, including the hydroxychloroquine and the lopinavir and interferon. Those are the medications that very most frequently mentioned in the early phase of this pandemic. So they at least I think the WHO providing very good some clinical evidences to support them in the future practice by the infectious disease specialist. And then for especially for the Remdesivir, I think earlier I actually talked about this COVID-19 is a biphasic disease. The first phase is probably dominated by the viral replication, but then which is followed by some excessive immune responses. So depending on which the phases patients are, we have to choose very carefully which medication to use. And then if we use like antiviral in the sort of the second phase or the cytokine storm phase, that's almost useless. So based on the all the experiments, even with some animal experiments, I think actually the Remdesivir would be the best if we use in the first phase, the viral phase. But then at this moment, the Remdesivir is administered as IV injection drug, so that somehow hinders the early access of the drug to the patients of mild cases.
I see.
Yeah.
And staying with the excessive immune response, Dr. Kwok, Korea recently reported third case of multisystem inflammatory syndrome in children. For the sake of our viewers, could you tell us a bit about the syndrome, its symptoms and its relation to COVID-19?
Sure. So it's abbreviated multi-system inflammation syndrome -C, which means for children. It's basically a bunch of symptoms that happens to children that shows up as fever, rash, possibly some other gastrointestinal symptoms like nausea, vomiting, diarrhea, but also other conditions like showing lack of oxygen in the progress of time for the syndrome. It's not something entirely new we see from a viral source, though. So we saw many other children who has had a syndrome called Kawasaki syndrome. It's a very similar in fashion syndrome that's caused by other possible sources of bacteria or virus, except both of them, we do not know the exact source of virus from. With the MIS-C, the definition has to include prior exposure or prior infection with COVID-19. So this syndrome is solely going to be based on the fact that it's possibly due to COVID-19. The fact about this is that because everything is so new, even in regards to the syndrome and also to the virus, we're not prepared with any medicinal treatments yet. So, well, I think we're going to try our best to keep it contained for the people who have it. The luckiest thing about this is that we have so little of the number of the people who got infected with them, and also the fact that they were all now discharged healthily and safely.
I see. Very briefly speaking, Dr. Kim, I understand this will be a difficult question, but what are the chances of a vaccine here in Korea within this year?
Within this year? Well, the vaccine?
Yes.
Oh, I don't think it's possible.
How far have we gotten so far?
Well, I think in the vaccine in Korea would be available, I think maybe late 2022, late 2021, or just earlier 2022.
I see.
That's my guess. And probably just the development of the vaccine would be just probably accomplished by the end of this year, or probably most of them probably earlier next year. But again, just the manufacturing and the distribution issues. So in Korea, I guess probably just as early as, earliest just possible date is probably just mid or late next year.
I see.
Yeah.
All right, Dr. Kim, as always, thank you for your thoughts today. And Dr. Kwok, thank you for being with us.
Thank you.
Right, well, that ends our coverage of COVID-19 for today. Efforts to contain the virus are being outrun by its speed worldwide. So do take care to ensure your own health, especially amid the colder weather here in this part of the world. Thank you for watching.